Yeah.
Let's job about you.
Love it. Love it. Digging your background. I like the raccoon. That's cute.
Thank you. That's my husband's spirit animal.
Beautiful.
Yeah, actually, that's one of the best gifts. That was me to him. That's why it has the South Park mug, which I'm still debating. Maybe shouldn't have that as my background. But I don't know if you have seen those little toys that have the pouches inside and you can warm up to
Oh,
them.
yeah, yeah, yeah. I
Yeah.
like that.
A frequent theme in our relationship is I'm very tactile on
Mhm.
touch until I'm tap out. There's
Yeah.
sometimes that I just want to turn all lights off. Nobody touch me. Nobody looks at me.
Yep. Yep.
Nobody ask me for anything. I feel like we always end up meeting each other, right? The people who like touch and the people who are not very touchy. He gifted me that this is a form of me.
Oh, yeah, because it's a spirit animal. That's cute. I love that.
Yeah, and the tail is the best, one of the best fidget toy you will have because it's like a fluffy tail.
Yeah.
That's a very cool toy for anybody who is in the same position, wanting more touch. Maybe the partner wants to. People who are not used to it, they
Yeah.
want to. It's just not something that pops up in their mind necessarily. Sometimes we make it all about ourselves and it has nothing to do with us.
Very interesting. Love that.
How about you? Tell me what you do and what do you commonly see? What are the overlaps that you see? I'm really, really glad to connect with you today.
I have a lot of different interests. I work with pretty much everyone. There is a wide range, which I find interesting because I am not super niche where I only see one type of thing because that can get really boring for me. I like novelty. I have ADHD myself, and so there is some dopamine in getting to see all different types of things and just the excitement of seeing something new. I really get excited to work in a lot of different realms, but probably my most common niches that I get excited about are the people that have adult ADHD. I really enjoy that personally because I have experienced myself, but also the medication options. There's all kinds of new stuff that's coming out, and so kind of comparing all the different meds there, but also the different types of therapy options that you can involve with for treatment. Is there a medical piece to this? Are you having ADHD like symptoms and you actually have a medical condition that is leading to that? Or do you have severe anxiety that's mimicking this? Or is it trauma related? Is it a mix where you have some of both? And do we need to treat it in a different way? I like to work with folks that are experiencing issues with libido, either people that have low libido for whatever reason. I'm kind of clarifying what's going on there. Is there a medication that could be beneficial? Often, pretty much for any of those folks, they should probably go see someone like you, and involving some work and kind of collaborating from that end. And then also people that may have extra high libidos that maybe are getting them into some trouble, either kind of in the criminal situations or just where it's making more of an issue for them to be able to focus on what they need to do. The other kind of niche that I get excited about is body focused repetitive behaviors, things like trichotillomania, which is where people are pulling out their hair, or skin picking, excoriation disorder. That's, I find interesting just because there are these wide range of treatment options and there's new information coming out all the time for this of some really amazing things. You can see such a huge difference where someone has come to me, they're having to maybe wear a wig and they've pulled out all their hair, and we're able to work with them. They're able to get some good therapy, they're able to get some medication options and go to the point where maybe they're not having to wear that wig anymore and they feel a lot more confident, and that's not taking up so much of their time throughout the day, because sometimes those behaviors can start to interfere with your ability to do the work that you want to do or the relationships you want to have, because it's really can become quite time consuming. Yeah, so those are probably my main interests. And then I guess the one that I've been spending a lot of time on more recently is the idea of a trauma spectrum. I work with a lot of patients that have borderline personality disorder, people that have PTSD, people that have the idea of CPTSD or complex PTSD, which is something that's, kind of more new age kind of idea, but it's really, I find it to be quite a useful topic to talk to patients about. And since I moved to Florida, I've gotten more into this realm because I have a lot of patients that come to me that they've been on this huge list of medications, like a mile long, and nothing has ever worked for them. And often it is because they've been diagnosed incorrectly and that they do have a trauma disorder, and that maybe this is not bipolar disorder. You do not need to be on lithium for this. There are other kinds of things that we need to look at, and we need to see this as a trauma disorder. There's also a lot of stigma around that. I really enjoyed DBT. I don't do much DBT myself anymore, but I really find it to be an exciting area. And so I like working with some different therapists that are into DBT and kind of collaborating from that standpoint. And so, yeah, those are probably my niches that I'm into right now. But again, I always kind of get excited about some new things and can go down that rabbit hole myself where I get a little bit of hyperfixation on things. But right now, those are the ones that I've spent probably my longest amount of my career focused in those realms.
What are some of the root causes of those body repetitive behaviors?
There can be a lot of different reasons why that can happen for someone. There is quite a bit of overlap with OCD. A lot of people that come to me, we want to make sure we're also ruling that out of, is this a component of the OCD? Or is this something very different? Sometimes it can be a coping mechanism that has developed in the setting of anxiety. Sometimes it's something all on its own, and that can develop from a lot of different things. It could be something that was a trauma background, that when they were a kid, that this is something that developed and it is a soothing mechanism. A lot of different reasons of why these things might come up. But understanding that, of like teasing out like, okay, what type of repetitive behavior is this? What is like your understanding of why you do that? Like, do you have any awareness that you are doing it in the moment? Kind of clarifying like what that feels like. Is this something that brings you some comfort when you're doing it? Figuring that out can also help with the treatment. How much awareness do you have, and how can we bring more awareness to the situation? I often do bring that into my appointments with my patients when we're talking about it, because I think that it is one of the most important pieces. The medications can help, but I find these kinds of medications to be something that may not really need to be a forever thing. This is a short-term intervention, so we can help you get to where you want to be. But the therapy aspect is really what's getting at the root of the issue, so we can understand this and help you develop those coping skills so that you can go and not require these medications, which is something I believe for pretty much most psychiatric conditions that I treat, is that medications do not need to be a forever thing. Although, not everyone agrees with that, and I definitely have a lot of patients that come to me specifically for help coming off of their medications in a safe way. There are only a handful of conditions in psychiatry that do require more long-term, kind of lifelong medications.
Why do you think that's such an unpopular opinion in some psychiatric groups? Like, being on medication can be for now while we work on the skills. Why is that so frowned upon?
Yeah. I don't know. I mean, I think there's probably a lot of reasons. I think one, it's an old school kind of way of thinking that, okay, you have, say, generalized anxiety disorder, that therefore the studies show you need this medication treatment. But from my understanding of that condition, it's something that if you can do some really good therapy and get to the roots of what's going on for your anxiety, that the medications may help you get to a place where you need to be, but you may need less medications over time. And the hope is we can even get you off of those medicines. It is a complex thing because since moving to Florida, I've also had a lot of experience with that the amount of prescribing here can be a little bit like the Wild West. It's a little scary at points that I'll have a lot of patients that will come to me that are on these huge mile-long lists of all these different kinds of medications. And why have they never been stopped on any of these? If you put them on this many medicines, and some of these medications have overlapping things that they do, if they weren't serving that person, let's, clean this up, because there's a lot of interactions and worsened side effects you can have. Is it a money thing? Is it that, that they want to keep these people on medication so they keep coming back to them? I hope that that's not the case for most people, but, I think it's always a possibility. I think also it's scary to me that I recently got it's like this kind of program thing that it will send me okay, what is the most prescribed medications by providers in Hillsborough County? That was a really kind of scary thing to see, that the most prescribed medications in this area were things that I'm like, these are not things that should be commonly prescribed. These are things that we should be very careful with, and that a lot of patients that are on medication, such as like the number one medicine on there was Xanax. I do not like Xanax. I am not a fan of it. If someone comes to me that's on it, I'm not going to immediately take them off of it, but it is a medication that should come with more warning, because out of the different kinds of medication options for anxiety, such as benzos in general, Xanax is a type of benzo that is not my favorite one. It's one that's harder to come off of. It's one that has a lot more kind of addictive qualities to it, of how it's very fast on and fast off, and that it can be really painful to come off of. But there's not a whole lot of warning that my patients get when they have that. They'll come to me and they're like, no, I was never told that this medicine is really hard to come off of, or that if you're on it for a really long time, it could potentially cause a lot of cognitive processing issues. You're coming to me and you think that you have ADHD, when in reality, you're on a huge amount of Xanax that is numbing your mind and causing a lot of brain fog for you. Let's help find you something that helps your anxiety, but it's not causing you side effects that's interfering with you being able to be who you are and your personality. Sometimes those medications numb people up. I think it's also just miseducation. People don't really know the information behind this. They're not staying up to date on the teaching, or they haven't had enough training to understand that. You can see like, okay, this is what FDA approves, this, and this. This is stuff that's commonly prescribed. But doesn't mean that that's the right answer. Having some good information, really staying up to date in, what is being proven and what is the risk involved with these, I think is an important aspect to being a doctor.
Do you think prescribers are using it as first line of treatment instead of working their way up to, well, if everything else fails, then we do this?
I think so, because I will have a lot of people come to me, what meds have you tried before? And they will be, maybe one other med before or none. And that will be the only thing they were ever tried on. That's really disappointing to me. The other thing I'll see is that they're put on what I call the drug rep special, where there are a lot of drug reps around here that are, I'm sure, really good people, and they don't have anything that they're doing that's particularly wrong. But sometimes, when they're going around giving out all these free samples of these brand new meds that haven't been out for very much time, there's not a ton of studies on them. Sometimes those meds get pushed a little harder. Also, there can be some incentive that people will specifically prescribe those meds, because this stuff is tracked. You can look and see how many times so-and-so has prescribed your new drug. There are speaking opportunities where people will go and speak at conferences and get paid for speaking about these medications. There is sometimes a financial incentive of, why are you being prescribed this much of this brand new antipsychotic, when that should never be a first line agent for someone with anxiety or depression at this point. There are safer choices. That means that those medications are totally bad. They are good medicines. Using them as first line when there are safer options that are also cheaper. Like, I can't, also say that you're being put on a medication that's costing you $200 a month when there are medications that are safer, have a lot more evidence. We know what we're getting into with them, that cost you, $4. Yeah, I definitely think that that's something that's important to think about too.
That's a big ass difference.
Yeah, it is. It's wild. I don't want to pay that. If that medication was the only thing that has ever worked for me ever, yeah, I would be down to maybe pay that if I absolutely had to. But yeah, if you're using that as the first medicine when there are other ones that are safer, have more evidence, and are way, way, way cheaper, yeah, that's the route that I prefer.
How does that route to treatment look like? Where do you start people? What does that process will look like for them? How do they find you? How do they know that you're the right fit?
I offer free 15-minute consultations when folks want to kind of talk and see like, okay, is this a good fit for them? Often they'll find me on either like Psychology Today, or they'll Google psychiatrists in the area. They'll read up. I think a lot of people will read my website and see that I have a good training background background, having trained at a Harvard program, I think that that gives some people reassurance that at least I have the education background that could be potentially helpful. Also, I write a lot about on my website my different specialties and my ideas surrounding how to treat some of these conditions. I think that's also important for people to know that just because they're coming to me doesn't mean that I'm going to push a medicine on you. I am not someone that believes in like we need to throw medicine at people. No, there are people that come to me that when I meet them and we talk through the different kind of treatment options, that I will straight up tell them, I do think potentially the best option here is for you to pursue therapy. For most people, I will recommend no matter what, but some people I only recommend that at this point, I think a medication wouldn't serve you the best. Like, we can continue to explore that and talk about it. And if you really feel strongly that you think a medication would be helpful for you, like, let's understand that and let's think about it. But not everyone needs to be on medicines, and just because you go to a psychiatrist doesn't mean that you should have medicines thrown at you and that you should be trying to convince those people to take meds, because that's just not what you should be doing. That's not what you're here for. You're here to provide someone with information and to help them better understand what their options are. Sometimes those options are, have really low like vitamin D levels or really low like B12 and you need to take a vitamin, and that could really be a huge impact on your mental health. There are some things that are as simple as that. A lot of people want to see a psychiatrist that isn't going to just treat them as this number where they're coming in, they're spending 10 minutes with you, and then they're pushing you out the door. They need to have a psychiatrist that wants to understand them and get to know them and hear their story. Because if you don't hear someone's story and you're just basing it off of straight up like, this person come in with depression. Everyone's depression looks very different. There are all different kinds of symptoms about every person's individual kind of experience that can help you guide, okay, which medication options might be the best for it? What type of therapy could potentially be the best for this? And so having an understanding of, there is a lot of variability here, I think is another reason that folks want to come with me, because I will talk through that and I will spend an hour in our first appointment to really get to know you and let's come up with a game plan together about what potentially could serve you the best and what could be something that doesn't have a ton of side effects, because we don't want that either. We don't want to load you up on stuff that's going to numb you up and not feel like yourself.
How do people know where that line is between going to counseling and starting on meds?
That line is something that can be blurry. And so often it is involving kind of, okay, so where are you at this point? Have you tried doing therapy yet? Have you tried going to counseling? Have you tried to explore this in other realms? Maybe they haven't done that yet, but their symptoms are really severe to the point where it's interfering with their ability to do their job or to take care of their children or to have this closeness in their relationship, because they are feeling so deep in the depression that it's led them to be really isolative or stop eating or any kinds of symptoms that are really interfering with their mental and physical health. The medication piece to help them kind of jumpstart, let's get you where you are able to be able to engage in the therapy. Sometimes that will be an option, but we kind of explore that of, okay, where are you at? What have you tried? And let's see what might be the best and safest choice for you.
I will take a minute to do a bit of selfish question. So the other day we were talking about with my direct physician about understanding your rhythm, your pattern, so you can build a life that works for you. Mm-hmm. This morning I was sharing with my husband that my main struggle is that they feed on each other, right? It's a cycle: organization, consistency, and routines. We are trying to explore, okay, is it something you can achieve without medication? Where's the line of get on medication, build skills, accept the way it is, and figure out how to make it work. Figure out a workflow that works for your brain, how to build routines that will actually make sense and stick with your rhythm. What are your thoughts on that?
Each individual person is unique. I would ask questions such as, what does your day look like? Okay, what areas of your day are struggling the most? What kinds of things are you experiencing? And, what kinds of coping skills are you using to help you through those things? Okay, you have been using a lot of really wonderful coping skills and it's still feeling really hard to get to where you need to be. Kind of exploring that and figuring out, is this something that maybe a medication is going to be useful for? Have you failed like this long list of medications in the past? Okay, let's look at that. Let's look at, okay, you were on this dose and you were tried for this period of time. That may be a medication that you never were even tried on a dose that actually works for human beings. You were on like the tiniest baby dose ever and you were on it for like 2 days. There are different kinds of ranges of time and doses that work for people. We want to make sure that we're figuring out like, okay, is this something that was a true trial that this person really failed this medicine, or was it put on their list as they failed it because maybe they were never tried on a dose that is legitimately gonna do anything for most human beings. Another thing that sometimes we'll bring in is the idea of using genetic testing. Genetic testing's been thrown around a lot lately. A lot of people are doing it, and it's something that I think can be a useful tool. However, there's also sometimes people will come to me and they're like, do you do the genetic testing? I'm like, yeah, I'm happy to do the genetic testing for helping people see, what medications and how like they metabolize them. But I also give them a fair warning that, these kind of medication genetic testing that's done, like, it's not going to say which medication works best for you. There's some claims, like people will claim, like, I'm going to give you this genetic testing. It's going to tell me exactly the meds that are going to be the best choices for you and how well they work. We just don't have that science yet. The genetic testing can tell us a little bit about how you metabolize the medicine. Maybe you're a super fast metabolizer. Liver is chewing up the medicine and you may need a lot higher doses versus someone that's liver is like not really eating the medicine up and it's kind of lingering around, and you may need lower doses or else you're going to have more side effects. It can tell us stuff like that. However, there are some studies that show that some of these genetic testing is kind of iffy on even how well that stuff translates to reality. But for people that have a bunch of things they've tried, I will order that testing for them. Or even if they come to me and they haven't been on a ton of stuff, but they would like to, know a little bit more about their body, I'm happy to order those tests for them for those reasons too, to give some more information. The studies compared someone that had the testing versus someone else who didn't. They did some controlled trials on it that, there wasn't much difference in outcomes. So it's more of a information kind of tool, but how much it translates to the end product of what we end up using is variable. But that is something that I run into a lot, is that people are being told, oh, I have this amazing tool that will tell you exactly which medicine works for you, when that doesn't exist. So if people tell you that, just kind of question it. There isn't a magic ball that will tell you that at this point, but we can, fingers crossed, hope that will be a thing in the future.
It sounds a little bit like a scam.
I think so. I do think so. There is a lot of scamminess to it. And it was interesting because some of these genetic testing places, they also showed that if you sent it to one lab versus another lab versus another lab, you would end up with 3 totally different results when you got the answers back. That how reliable are these tests is suspicious. I use one that's had a little more research than others. However, I still take it with a grain of salt. This is not the end all be all, and that we still need to use the tools that we have that we know are useful, such as me taking a really good history, really understanding your symptoms and how you interact with medications, and using that as an additional tool, but not as something you should base a treatment choice alone.
Sounds like a great project to do. Just with yourself, apply to all of them, make a video about, okay, this is how I would treat this person if I only had this information, the same person in different areas, according to the results, see what happens then.
Yeah. They sort of have done that. There have been some full controlled trials that did that. Basically, the results of that was that there wasn't, that you would get a bunch of different results, and then was one of them like the better option when you treated them as such with this program, or this program. The results mostly just showed that the results were just as good as if you didn't have any testing at all. So, yeah, I ask patients to spend $200, $300 on testing, although there are a lot of places you go to, and that is one of the first line things they recommend. Here, get this expensive testing done. I'm only will mention that if I think, okay, this is someone that we really might see something on it, such as your metabolism of a medication is going to be really unique or different in a way that would serve us in picking which medication is going to be useful for you.
Do you feel there's some truth to the idea that sexual kinks or interests are linked to some genes?
I mean, I think that that's a really curious and interesting concept. Have I had any proof that like is a thing? No. However, how much research has been put into that? Not much. There really hasn't. It is such a curious thing that I do wonder, in my kind of more forensic-y side of that, there are some different conditions that can lead to, say, some different kind of sexual paraphilias or different kinds of struggles that people may have. Not exactly purely genetic, but different conditions can have a kind of sexual issue from the condition itself. So yeah, I think the genetic piece is something that's really curious, and I would like to see more about it, because there is always this kind of nature versus nurture. Like, is there something that you were born with that has kind of led to, and just like how your genetics work? Is it something that about the environment you were raised in? Is it something that just some people are more open and curious and are able to kind of explore these things? Would these things be more widespread if people felt less stigma, that they were able to explore these things and figure out what they like and what they don't like? That's something that I think is also playing a role with who is experiencing things and who has interest in different things, just based on how much stigma is involved with what they're interested in or how the environment they're raised in. I grew up in Arkansas, where it's a very rural state. There's more cows than there are human beings. Talking about sex in general is something that, is not done. There is no kind of discussion about sexual education. Any of that was really done, especially with women. That's something that they kind of stay away from, that the abstinence is something that's really heavily taught. But all the rest of this is not something that is more openly spoken about, which I think all over the United States that is an issue, but especially in some states where maybe it's more rural or it's something that has even heavier stigma than others, that I think that also you could maybe see some statistics of people's different kinks based just on how stigmatized that area was for people and how repressed that could become.
A parenthesis on the conversation on genetics. How do you jump from Arkansas to studying paraphilia?
I kind of fell into. Somehow I really worked my ass off and graduated at the top of my class in medical school, which did require a lot of studying, just lived in the library. I lucked out in that the way that doctors are sent to the different programs they do their training in, I was becoming a psychiatrist. Where was I going to do my specialty residency training? You make this rank list. I interviewed all over the country at a bunch of different places, and I made a rank list. Then the day we're about to learn where me and my husband are going to match. He's also a psychiatrist. We go up on stage, we have our little envelopes. In Arkansas, they did this in a way that was kind of, horrifying in a way, because this is a very deeply emotional experience where you're about to say, like, you're going to open your letter and it's going to tell you, like, you need to move to this place. You kind of have to move to this place for us was 4 years. For some other people, like my friends in neurosurgery, you're going to need to move somewhere for the next 7 years. And so we're up there and we're like, okay, now you get to open your letter in front of a huge crowd, all your friends and family, everyone's friends and family. And you have to read where you matched at, which for some people, when they open that letter, it's going to be a terrible experience, really scary, where you just matched your lowest one that you hate, and you're like, oh, now I'm sobbing in front of the whole crowd. It's really, a little traumatizing. But thankfully for us that we both matched at Harvard programs in Boston. The photos of when we matched there, our jaws just like, oh my gosh, like, we had no idea that that was going to happen. I worked really hard, but to be able to match from somewhere where I grew up, rural Arkansas, first generation of females to even go to college, first doctor in my family, to match somewhere like a Harvard program, coming from somewhere like rural Arkansas, where I grew up in a town of less than 1,000 people, really, really small town. That was huge. And so moved all the way up to Boston and went to a program there that, I had a lot of different mentors. And I found myself with a bunch of mentors that were in the kind of paraphilias realm. And that was something that was very interesting to me because I am a kind of true crime junkie. And I really enjoy trying to understand, why do people do the things they do? And why do they commit crimes that are really sometimes very disturbing and horrifying crimes? And that was an area that I wanted to understand. Why are people doing this? Why are they doing what they do? That was, kind of a piece of that, of why are people committing maybe some crimes in the realm of sexual violence. And yeah, that's kind of, the gist of it. Is I fell into it, and I just lucked out with having some of the best mentors in the country for that specific thing. I don't do as much of that work anymore in private practice because it's not super safe to do that on your own, but it is something that I still enjoy understanding and keeping an eye out in the community and in the media, what's going on in the world, and trying to understand, why are people doing the bad things that they're doing.
What did you learn from that time?
So many different things. I mean, probably the area that I spent the most work in was working with people who did some of these really horrible, bad things, but they also had really significant major mental illnesses, such as these people that had untreated schizophrenia, that were really sick people that were not on medications. They were not themselves. They were something other. And it's a kind of hard thing to hold, that when this person is on their medications, that they look like a completely different person. And when they look like that person and they realize, when you tell them what they did, they're horrified by that. This is something so dark and disturbing, and that there are people that in their own lives, because they realize that they did once they are treated. I first experienced that when I was in Arkansas. There was a young kid, he was like 18 or something, and we were interviewing him for basically what forensic psychiatrists do to decide, is this someone that is not guilty due to mental insanity. He was up for capital punishment. He had schizophrenia, and he had, lit a couch on fire, and it killed a lot of people. And so things like that, one that has done something and then it has harmed a lot of people, but is this person ill? And should we be thinking about this? I also met a lot of people that were what we call antisocial, which, when people hear the word antisocial, they think someone that's like, doesn't like being around people or has social anxiety. From a psychiatry standpoint and from the DSM, antisocial, more of like what we would call someone that is a psychopath. I met a lot of those people too, that would come and they would tell you those same things. They'd give you the kind of, sad story. They would cry those tears sometimes even, and try to convince you that they did not do this, did not understand what they were doing. But when you get to the end of it, there are people that are doing some really bad stuff, and they will lie to you about it. So I think I just learned a lot about human beings have this unique brains, that there are all these different pieces of it, and trying to understand human beings and get to know them and hear their stories is something that I like to do.
I love that I get to ask questions. That's the thing you don't get necessarily from like out in the world. But here you have permission to not just listen to the story, but you get to ask questions about it. That is one of the things I love about this. You get to actually get close to it. In terms of paraphilia, there's a lot of that is still shifting, especially when it comes to pathologizing things that shouldn't be pathologized.
Yes.
How do you help people understand, like, to me, I love all good sex is good sex as long as it's consensual and pleasurable.
Yes.
Anything that's in there, we're good.
Yes.
So, and can you speak a little bit to that? And what are your thoughts on sex addiction? What is your perspective on that topic?
This is something that I did a lot of my education piece with and teaching the program I was at about, because there is this kind of overlap of this kind of blurry line. But I think exactly what you said, if these are two adults making a consensual decision together, that is where the line is. For something to be considered a paraphilia in the DSM, this involves that either this is a non-consensual kind of thing where someone has a sexual interest that involves non-consensual sex, or there is, this part I think is a little bit more blurry on where this line should be, or there is a piece that is someone really, really disturbed by their own sexual interest that has led to, interfering with their lives. However, that I feel like is such a blurry piece, because the amount of stigma that includes this specifier about, but it can't be like due to societal pressure. But how can you really tease that out? For the most part, it's not super useful, and the DSM should really think about that, because where is that line, and how can people really fully understand, is this something that is causing them a lot of distress and they feel very disturbed by these thoughts? Or is it that there's an underlying, they grew up in an environment where this was shamed and this is something that's so upsetting to them because of what society has put them into that environment? But yeah, mainly is this a consensual kind of thing? Because there's a lot of paraphilias that when you look at, these are also things that can very easily be a fetish or a kink for other people.
And there's also an important difference between knowing what is a fantasy and play pretend. Maybe you're having 4 sex fantasies, whether you are the person doing it, the person who is submitted to it. But in your mind, there is total consent. You have the power to control it. It's different to play and pretend, and sex is just play for adults with adult toys. There's a difference if you're feeling like, oh, this is something that I may do it, and I need it to be truly non-consensual for me to enjoy it. I do the work with everything is consensual. I would want to play pretend, right?
Yeah. That other, yes.
The other side of it, we should have people that you can go to, because if it's something that you're actually worried about doing, then you need to seek intervention, and that will allow you to actually protect yourself and others around you.
Yeah.
But if we don't talk about it, if we don't know, the shame and the fear is bigger. It's an obstacle of finding people who will actually be able to help with this. My first experience with it is only book, I think the book is Two Sides of the Brain or something like that. Two Tales. I don't remember the name now. But this specific person had a tumor in their brain. So it came out of nowhere. They find that out, and it went away after surgery, and then it came back, and turns out the tumor was back. So if we open that communication, then we're able to help more people. And so we're able to prevent rather than just continue with, yes, therapy for sexual trauma is amazing, but if we work on prevention, then sexual trauma will happen way less often. And we don't talk about sex, and we don't have an avenue to ever talk about these topics.
Yeah, absolutely. That is something that there are not a ton of different people that you could go to speak with about that. I thankfully did work with some people, at least in Massachusetts, that did do that kind of work. Is this something that is potentially dangerous? Are these fears legitimate fears? Or is this something else? Because also with OCD, that can be something that can really come up for someone, of intrusive thoughts, of these like really dark things. And sometimes they can be sexual kind of dark things that they're very disturbed by. They're like, I would never ever do this thing. I am sickened by it. There's a really good TV show it's on Amazon about OCD for a woman who is experiencing sexual intrusive obsessive compulsive thoughts. And they're about anyone and everyone off the street, about her own family members, her parents, like things that she would never do, but were really, really disturbing to her. There are people that will, come to me and talk about that. Let's help figure out, is this something that you need to explore because this is a healthy thing? Or is this something that is a symptom, just like you said, for the person who had the brain tumor, that there are some different conditions. There are some different seizure disorders even that can have symptoms such as that, where you can develop some very unusual sexual interest that you say, I would never ever do that. That's not something I'm interested in, yet somehow it keeps kind of replaying in my mind. And so, yeah, that's something that I think is a interesting area area, and that there's not enough people doing the work in that. But there are psychiatrists that do. It's just a very specific niche. I work with a lot of the people that have that kind of intrusive sexual thoughts with OCD. It is important because when some of these things are treated, such as if that girl on the TV show that was having all of those disturbing thoughts, it like led her to move to another country, and that she had to stay away from her family because it was so upsetting to always have those thoughts going through her mind, and it was interfering with her ability to work and things. When you have treatments such as going to your counseling or therapy, or potentially get put on a medication to help with OCD, those thoughts really can lessen significantly. There also is a lot of help with understanding these obsessive compulsive OCD thoughts. These do not define you. You have not acted on these things. This is not something that you want to act on. It's not something that you're going to be pushed to act on per se. This is something that's part of your illness, and we can treat that. It is treatable. But yeah, this is always a kind of blurry line of like, let's figure out, is this part of someone's illness? Is this something that's repressed and they need to explore, and that is a healthy thing for them to experience? Or is it something else? There's some gray areas here, and so we never want to shame someone, especially if they are having thoughts that are about consensual adults. We want to make sure that we're not blaming something just because if someone has OCD but they're also having these interests, that could not be part of their OCD. We don't want to try to treat something that's not an illness. And so yeah, there is a lot of kind of nitty-gritty little pieces that we need to make sure we understand, so we are being careful and we're not shaming people.
And if it's not an illness, we can sift through it. We can understand what it means to you. Do you want it to just be a fantasy and just live in your mind, or just live with erotica that you read or watch or listen to? Or is it something that you do want to do? What does that look like, and what it looks like for you to be safe? I feel like fantasies, real life sometimes doesn't live up to it. In the fantasy, you have so much control. So how do you let go of control, especially when you have been raised in a culture of sexual shame? I see it a lot in the women's group. My boyfriend this and that and all that. I have been involved in some arguments and back and forth of what my thoughts are. But at the same time, I know that the types of things I work with are different than what some other people are experiencing. I understand that there's a spectrum of, yes, we need a higher level of support here.
Yeah.
But what comes to mind when we think about these things?
Yeah, so these things are, again, another gray area, exactly what you described, that I will have a lot of people that will come to me saying that they have a sex addiction or they have a pornography addiction, and when you talk with them, you realize that this sounds very normative. Like, these are like very normal, healthy behaviors, but for some reason there has been this heavy stigma placed on it. Where they feel that these things are bad and that these things are dangerous for them. And okay, in what way are they dangerous for you? Are they dangerous for you because it's led to where you're watching porn all day and night and you're not able to do the things that you want to do in your life, such as go outside and go to your job and have a relationship, whatever it may be, that it's invading your space and that you're having difficulty controlling this for yourself and that it's becoming something that is obsessional? Or is it that you enjoy it and that it's fun for you and that it's exciting and pleasurable? That is something that can be very normal, but is something that the stigma can really be harmful for. And so that is something that I'll often talk to people about when they come to me. The idea of sex addiction in general, what does that mean? This is not really something that is 100% a true diagnosis. Is this individual someone that it is interfering with their ability to do the things that are important to them? Is it causing them issues in like their ability to live their life? Why is that? Is that because the stigma around them? Or is that something more inherent to what they're doing? Because just because it might be causing difficulties in your relationship doesn't mean that you have a sex addiction. It means that you probably need to go to couples counseling and sex therapy, sex counseling to discuss that. There are a lot of layers there, and so I think it's really important for folks to understand it. However, I do get occasionally people that'll come to me that are struggling with more of what we call like hypersexuality, or sometimes referred to as like a kind of sex addiction, that it is interfering with, like, they're feeling like it's hard to do those things that they want to do, and that there are some ways to treat that. Is it kind of getting in the line where they're like worried that they're going to get into some trouble because they're like, going out and doing these things in public that's not safe to do for other people or themselves? Like, it is something that is a kind of fine line that we have to look at and be careful with, because you don't want to really shame someone when there's already so much stigma there. It is an interesting area, and I think is an area that continues to need more research of like, how do we define these things and what is the healthy way to think about it? Are we just basing this off of what is considered normative sexual interest, or just because this is a smaller kind of minority of people that have this interest, but it's safe, it's consensual, then we should really think about why are we considering it to be this illness. So yeah, it's a complex gray area.
My approach is, the problem is not that you're watching porn, it's that you feel like the watching porn is out of your control. Like, it's not something they're actively choosing, which kind of feels intrusive. It feels like you don't have a choice to just, hey, I can't do this right now, I have to get this done, I'll do it later or whatever. They tend to be conflict avoidant. They tend to not have clear stress coping strategies. So usually that is their way to cope. I sometimes ask, okay, do you spend more time watching the videos or do you spend more time scrolling through them? Well, sometimes, especially if they have ADHD type symptoms, we love scrolling and opening tabs.
Yep. Hyperfixation. Yep. That just kind of rolls and rolls and rolls. But yeah, we do see that. That's a good kind of point of, what is this? Is this part of a symptom of a different condition? What's going on here? Yeah, it's a great point.
Usually I find like the sex and porn addiction can be coming from sexual change. They have some interest, or they haven't explored as much, or whatever that is. They have very poor sexual communication skills, so they don't feel really comfortable talking with their partners about sex. Which, then what are you going to do? You're going to go to the place where you don't have to talk about it, where you can just get exactly what you want and even browse different ones, and it's always something new, without you having to do much for it. Sometimes it's just a shortcut. It's not about the porn itself, and porn is not a bad thing. I feel like a lot of people want to make it the bad guy. He's the founder of modern intimacy. He talks about, we want to make porn the bad guy because all of these topics are there. But if they're there, it's because humans are making it. We are looking for that and creating that. I do think that maybe what's important is shifting the way that we create and the topics that we have, and maybe stop taking shortcuts. First of all, as our kids grow up and start getting to know what that is, if we just teach them, hey, this is like watching NASCAR. Can be entertaining, it doesn't teach you how to drive, right? This is just a movie. Then give people actual skills to, how do I talk about these things? How do I embrace being awkward? We don't see that in the porn, right? We don't see people being awkward. But I feel like there's some things also that you can gain from it, because sometimes there are things that you're not able to access in your real life for whatever reason, or you don't want them to. Going back to fantasies, maybe that's your fantasy and you don't ever want to have sex with a man, but you like watching men having sex. So I'm still very curious why that is such a intense reaction. I'm especially referring to the women's group because I see it so often there. What are your thoughts on that? What do you think people react so strongly to their partners watching porn?
To be honest, I don't know exactly. There's probably a lot of different reasons. I think one of them may be in the realm of jealousy and insecurity. If they're, say, watching porn about, X, Y, and Z, do you as a woman maybe feel like that you aren't X, Y, and Z, and that therefore, since they are spending all this time doing that, that they must be not interested in you? Is it a thing that is about your self-esteem and who you are? That's important for a partner to understand. Is this something that's coming from my own struggles? Is this something, my own anxieties, and I'm projecting this onto them, that they have an issue, when maybe, it's something we should think about for yourself? That is something that I probably see more commonly when I have someone that comes to me that, is struggling with porn or being told they have porn addiction, there is maybe a spouse that is feeling those kinds of sadness and anxieties about it, of fears of, am I going to lose this person? Is there some attachment struggles there that they're going through for themselves that they need to work through? But yeah, it's a kind of gray area that I think there needs to be a lot more research into, because I would say 9 times out of 10, when I have someone that comes to me that has been told that they have a pornography addiction, 9 times out of 10, it's a healthy kind of behavior, and that only those 1 out of 10 where things are kind of getting out of control and causing them a lot of issues. And often, just like you said, is this an ADHD thing? Is this a coping thing? What's going on here? And let's try to understand that. Is this serving you? Is this giving you the things that you enjoy and that you want? Or is there something else we need to look at? But the word pornography addiction, I think there needs to be a better term for it than that, because that doesn't really encompass, I think, the gist of all of it, that it is a little more broad and complex. Behavioral addictions in general are very interesting when you think about it. The idea of sex addiction compared to something like gambling. This person maybe enjoys gambling, but also they have X, Y, and Z that has led to them spending their entire life savings, and now they don't have a home. You can see a translation of like, okay, this has led to this, and that is causing them so much distress in their lives. They can't live their life how they want to. Versus sex addiction, I think there's so much more complexities there, and to understand that and where that's coming from, which the gambling can also have many of those complexities, but it is something that can be sometimes a little easier to see when it's going a little awry, or a lot of times those issues translate to the partner is struggling with the other person's sexuality and how they understand their sexuality.
I feel like I need to rewatch that, trying to understand where the script is coming from, right? We have intense emotional reactions to certain stories. We just don't know how the stories are living up in our bodies, how this sequence of things are automatically telling us how you feel about it. And we don't even know that we're reacting to that without understanding what's actually making these things happen. Why do we feel so strongly about certain things? I want to take the last time to circle back when it comes to ADHD coming up at the top of your class and owning your own practice. Like, how the hell what are you doing that is working for you?
Yeah. Well, it took a lot of work. It took a lot of therapy, and it took a lot of finding the right medications, and how can I use my coping skills to get to where I need to be. Because initially when I was not on medications, like when I was diagnosed a little bit later, because living in a state where there wasn't a lot of information about this, and as a female, you often can be looked over, even though there's a lot of signs. Looking back, a lot of teachers are like, she's getting in trouble for talking all the time, she never stops talking, and she won't sit still, she's biting everyone, all kinds of issues there. But the kind of, okay, was I spending all this time in the library to get to the same point that other people were getting, because I'm having to reread the same lines over and over and over again, to the point of where I'm like forgetting everything, and that I'm losing, my purse every single place that I go. Everyone tells me that I'm interrupting and that I am not letting other people finish their thoughts because I'm finishing their sentences for them. There was a lot of things to learn and understand and find, like, okay, how can I adapt this, and how can I use how my mind works and have it serve me for what I need it to without causing me so many struggles and making things a lot harder. I think that ADHD medications, just because you take one and it makes you better doesn't mean that you have ADHD, because the studies show anyone that takes them, it can help with their cognitive, just like if you were to drink a ton of coffee, you might be more sharp. But there is a lot of intricacies to how you can understand and learn and use that for yourself, of how can I use the things that maybe the stimulant is helping me with to translate to actually doing something useful, which I think the therapy piece is really a good part of that. I would teach the CBT for ADHD group at my program, and Boston where we would have our patients learn some of these skills, and we would all share the things. Like, I'm sharing my own kind of things that helped me in life. There's all these little tools that you can have. You can have your own things at the front of your phone. As soon as you open it up, it has your full schedule right there where you can see it. It will send you the reminder. So 10 minutes before, like, I know if I don't click that it's reminding me, because otherwise I'm going to get distracted. There are things you can learn and be able to use your brain, because your brain is a unique and fun and beautiful brain. We don't want to numb that. We don't want to take away someone's sparkle by throwing a ton of medications at someone to numb them up. We want to find that balance. Is this medication something that could be helpful, and how we can use the different coping skills to serve them. As someone that has experienced some of those things myself, I like to use some of that in my practice, but I also make sure to understand that every person's ADHD is very different. There's a lot of different types of ADHD, and it can present differently in a lot of different people. When you have comorbid disorders that can come along with it, like is this ADHD plus anxiety, ADHD plus this other condition, plus depression, like they can come out and look in a lot of different ways that we want to make sure we understand and take that in. Just because I found whatever to be helpful, using my calendar in a certain way, having my watch tell me before each session, remind me don't forget to do this. That doesn't mean that that's going to help the next person. We got to make sure that we learn about each individual and kind of try to understand their brain and what could be helpful for them. Sometimes there's a little bit of trial and error to it. Let's give them a go and see if it's a good fit for you. And if it's not, let's find what is and how can we stick to it and make it more of a secondhand thing. But I will say I really like this little Pomodoro clock. That's really helpful for me so I don't lose track of time. I can be like, okay, let's do a 20-minute set where I'm going to actually write all those notes for all those patients that I've seen this week. I really need to do it, but if I don't have a timer that's saying you only have to do this for 20 minutes, then you can go take a break and run around and do whatever you want for 5 minutes. That sense of reward and excitement helps me stay on track. But yeah, it was a lot of trial and error and a lot of having help from experts that helped me. It's led me to be like, okay, I want to give back. I want to be able to help other people through this. Are they someone that has adult ADHD where it was missed, that they lived with this in their childhood, but they had these supports and now it's getting worse? Or is it a hormonal aspect where now you're getting older, maybe estrogen is dropping off, we're starting to notice that your symptoms are coming out a lot stronger, and maybe before your coping skills served you and did what they needed to do, but now medication is needed. I enjoy really working with people over it, so it's one of the things that I advertise as one of my specialties, because it's a unique and fun, interesting space.
If there was one thing from everything that we talked today that people will take from you, what do you want it to be?
Ooh, that's so hard. That's such a hard question. Probably that just because you have a diagnosis doesn't mean that it defines you, and that one person's diagnosis doesn't mean that the next person's diagnosis is the same. Just because you have depression doesn't mean that your depression is the same as your mom's depression. My ADHD is not the same as your ADHD. Like, each person's brains are unique and different, and that's why the brain is the most complex organ in the body, is that it is this kind of unknown, unique thing, kind of like going to space. We go to space, but we don't know everything about it. It's huge. That's how we think of the brain. It's unique, and we're still kind of figuring it out. And that every person is a little bit different. That's probably my biggest take, since we talked about all kinds of different things today. Yeah.
I love that idea of visualizing the brain like going to space and how well that neurons and lighting up.
Yeah, the brain is space. It is, and it's what took us to space. There's so many different unique things about it. It's one of the reasons I became a psychiatrist. We are on the horizon. Finally, we're just peaking the kind of first horizon where we're seeing some understanding of why are things the way that they are? What is our brain doing? There's still so much unknown space out there that we have no idea what we're working with. And that's another thing we got to tell our patients, is that this medication is really helpful. There's a lot of studies on it. How exactly it works in your brain, we don't know that. A lot of the time we don't have all of those answers. It is important to talk to people about that. There's always new things coming out, and we're starting to learn more and more about the brain, which is exciting. It's a fun space to be in.
And sometimes a lot of like the pharmacology comes as a side effect. Oh, look, it did this other thing that we didn't expect, so I guess we're going to use it for this now.
Yep, exactly that. Many of the psychiatric medications just were medications that were tried for something else, and they're like, oh, it has the side effect of, like, making someone's insomnia better or their depression better. And then, ta-da, now we've made it into this new medication specifically for that. Yeah, it is. It's cool.
Well, thank you for taking the time with me. Now every time my brain is going on a million, I'm having a meteor shower.
Yes, that is. I love that. I love that. Okay. Well, it was wonderful to talk with you, and I'm glad that we got to explore a lot of new territory today, but look forward to speaking with you again soon. I'm Dr. Allison Jackson. I am a medical doctor and I am a psychiatrist. I am working at my private practice called Mindful MD Psychiatry, and I see the whole vast array of different types of patients that I love working with people of all different backgrounds, all different diagnoses, but I do have some niche interests that I really enjoy working with, and some specialties that I find to be really important. And the ones that I probably see the most of are people that have ADHD, adults with ADHD, so maybe people that have lived with ADHD since childhood and have been diagnosed when they were kids, but also people that maybe are wondering, do I have ADHD? And I need to have that clarified. We need to figure that out. And kind of figuring out, okay, is this what this is, or is it something else? Is this a medical condition that's leading to ADHD-like symptoms? Is this a symptom of a different psychiatric condition? And then treating that. I also work with a lot of people that have what we call body-focused repetitive behaviors. These are things like trichotillomania, so hair pulling out, or excoriation disorder, where you're picking at your skin and causing a lot of damage there. It can have some relations with OCD, but it also can have some different root causes as well. I really enjoy working with those folks and seeing the huge changes that can happen, where you can go from maybe losing all of your hair to growing that back. You don't have to have this repetitive behavior that's overtaking a part of your life. Other kind of niche interests, working with people that have struggles with their sexual health, whether it's kind of a low libido issue, such as medications maybe causing you to have low libido, and we need to make sure that we're either adjusting your medications or making do with your medications and trying to get it to the point where we need to be, and improving those libido issues, whether by adding a different medication or finding you a therapist that really works really well, such as our friend here. That's another place that I really enjoy working with. I do a lot of college mental health. I enjoy working with young folks, but definitely millennials. I see a lot of millennials. I'm a millennial, and I enjoy this group where there's a lot of curiosity about mental health and improving your mental health. Lastly, my specialty area is probably in trauma disorders, of someone that is struggling with, like, okay, is this a borderline personality disorder? Is this something like complex trauma, complex PTSD, or is this PTSD? Where is it on this spectrum? Helping people through that. Also, diagnostic clarification. Do I really have bipolar disorder? I'm on this whole laundry list of meds that have never done anything for me, that's not served me. Have you been misdiagnosed? Let's clarify that for people. I also have folks that come to me that want to have their medications, if they want to come off of those, and so helping people do that is another area that I enjoy working with them on, of clarifying diagnosis, coming up with a plan that, is this a time in your life where it's time to come off the medications? Because for many diagnoses, that is something that can happen, and I think is important for psychiatrists to really think about. Like, these meds don't need to be a forever thing for many people. It may have served them at one point in their life, and now they're ready to try either a lower dose or come off the medicine altogether, which I think is important to be able to do that in a safe space for us to monitor and make sure that it's something that you can do and feel good about, and that you can live your life in the way you want to live it. Yeah, those are probably the main things. The only extra one I guess I can think of is that anxiety, people that have medical kind of anxieties, people that have health anxieties is another area that I enjoy working with, because there's a lot of stigma there. People that are struggling with either finding a diagnosis for their medical condition and they have been told that this is all in their head. And so being able to work with them on their own medical anxieties, but also if they're struggling with a chronic illness and kind of anxieties and depression that can come with having a medical condition, such as having cancer or having POTS or any of the kind of newer stuff that's coming out with, the more evidence that we have, a lot of these things can have connections to mental health. And being able to work with people around those things is really exciting to me. So, yeah. I work with a whole array of things, but if you want to find me, I'm at mindfulmdpsychiatry.com or at mindfulmdpsychiatry on Instagram, and I'm also on the Facebook. So, yeah, reach out. We do 15-minute consultations. Happy to chat and see if mine is a good practice for you.
Thank you so much for sharing this time.
Anytime. It's been fun. We had a lot of cool stuff we got to explore today. I hope you have a great weekend and a wonderful Friday.
Thank you, you too. See ya.